I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. When it comes to in vitro fertilization or IVF, the dosage of medication used during the ovarian stimulation phase can influence the success of treatment definitely. However, the relationship isn't straightforward and higher dose doesn't always correlate with a higher success rate. Let's look at several key points to consider, especially when regarding the use of higher dosage of medications used in IVF. So the first criteria is ovarian response. Higher doses for poor responders, especially in cases where a woman is classified as a poor responder, that is, who does not produce a sufficient number of follicles or eggs with the standard doses. In such circumstances, higher doses of medications such as gonadotropins may be useful to stimulate ovarian function more efficiently. Then there are cases of hyper-response. Administering excessively higher doses may lead to hyperstimulation of the ovaries, which increases the risk of ovarian hyperstimulation syndrome, which is a potentially serious condition in these people. So that's the risk involved in giving too much of dosage. Then we have to consider the type of medications. Let's look at gonadotropins first. These medications stimulate the ovaries to produce multiple follicles. The choice of dosing often depends on factors such as age, ovarian reserve, which is understood through AMH levels and previous IVF cycles, or FSH levels. Now, medications influence quality. Higher doses of medications may lead to eggs being retrieved, but it doesn't necessarily mean that the quality of those eggs and subsequently of the embryos that will be formed later will be better. It does not mean that if you give higher doses, the quality will be better or the success rate improves. Let's talk about success rates then. So, age factor plays a very important role. The success rate of IVF can vary depending on age of the woman. Older women may require higher doses definitely to yield a viable egg, but may still have lower success rate due to decreased egg quality and quantity. So giving a higher dose does not increase the chance of success in these women. Then what's the approach? It should be balanced. A carefully calibrated approach is often preferred, and research suggests that tailoring the dose of medication to the individual's specific ovarian reserve and its response is generally more successful than using uniformly higher doses. Monitoring is also critical. Regular assessment is required throughout the ovarian stimulation process. Physicians, clinicians monitor hormone levels and ultrasound results to determine ovarian response. This allows for adjustments in medications and their dosages as needed to optimize outcomes without risking overstimulation. Individualized treatments are required. Personalized protocols are required. Doctors generally aim for individualized treatment protocols that are based on comprehensive assessments of a patient's reproductive health. This means that while some women may benefit from higher doses, others can do better with lower doses as well. So to summarize, while higher doses of medication can help in retrieval of more eggs in IVF cycle, they do not guarantee a higher success rate. The effectiveness of IVF treatment is influenced by a large range of factors, including the woman's age, ovarian response, previous response to stimulation, and the overall quality of eggs and the embryos that are produced from these eggs. Close monitoring and individualized treatment plan are crucial for optimizing outcomes. It is essential for patients to have detailed discussions with their fertility specialists to then determine the most appropriate approach based on their unique circumstances. To understand more, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.